I'm going to do her mucosal block. Just something to mention, guys. JC, the last 2 times that she has had her lips done in the past was with the Julie Ford technique. I just checked her lips and everything, and she doesn't feel or seems to have any filler migration, which is great. I've been asked sometimes when I'm doing trainings about how the possibility of migration with the Julie Ford technique. I've never had any issues with it. Never had any issues with migration. And I do probably like a 0.05 or 0.5 on each injection. So we're not going to finish. It's a 3 ml syringe with Lido. It's going to burn just a little bit in the beginning, but then it starts numbing everything. Okay. And it's going to feel a little bit weird. You're going to feel kind of like part of your nose a little bit numb too. Okay. So what I do, you have to kind of like pull the lip nice and well, right? And you're going to inject kind of like a line with her canine. And you're going to go 1, 2, 3, very good. Little sting, okay? Here we go. You do like a 0.5 right there. How was it? Not too bad. You're probably going to see like a little welt in there. You have a 0.5 of fluid there, which is normal. I do massage it a little bit, just let it absorb a little faster. And if you notice, right in the camera, you see the little fluid right there. You see that little volume. It's actually looks nice. A little bit of action right there in the PD4 fossa. Okay. Same thing on the bottom, okay? Align with that canine. And the good thing about this mucosal block is that she's not going to lose the movement on the actual muscle, so she can still kind of like animate for us whenever we're injecting. How are you feeling?
No.
And I don't transfer my product into insulin syringes. I just work with the syringe that is provided with the company and the needles that are provided with the company. I just don't see the need for it. It works really well. It's to me, in my head, I'm OCD with like sterility. So I feel like even if you are super, super careful when you're transferring that product and you're taking it out of the original container, it's not sterile anymore. So I just try to keep it sterile as much as possible. So the majority of the dermal fillers, they come kind of like in the same presentation. It doesn't matter what brand they are. They come in a 1 ml presentation, which I explain to my patients. These 1 ml, if I take the full product out of the syringe, is just a fifth of a teaspoon. It's a tiny little smear that we have. So we're going to give you as much volume as we can, right, with this syringe. I normally, when I do lips, I always save a little bit of product left to do the oral commissures. I think that's a great way to kind of like frame the lips. So we're going to do that. And if you want more, let's say in 2 weeks, once the swelling is gone and the bruising is gone and you are loving your lips, if you want to add more, you can always come back and we can add more. Okay. And we can play with, let's say you are like super brave and you want to do like full lips next time, we can add a different product over this one. It doesn't have to be the same one because at the end of the day, they're all HA. So we could add Juvederm on top of it, or even the Restylane Contour, Restylane L, or more kits. Okay. So kit comes with a 30 gauge needle. Okay. There's some offices that would like to do a mouth rinse before the treatment. I have it in the office, and sometimes I forget to do it, honestly. But that's always an option. Okay, a chlorhexidine mouthwash for the patients to rinse their mouth before. So this is what I'm going to be doing with the syringe. Okay, I'm going to be drawing on YouTube. So I'm going to do a little line on the vermilion border, more on the pink than the white roll, okay? And then for her, it's probably going to be 2 little lines, okay, because of the length of her natural lip, okay? So 1 little line right there, 1 little line right there. Sometimes I would do a little V once I'm here because I already poked her white. So I do the vermilion border and then I do another little line right there, like a little V. And then I'm going to go around, do the same on the other side, right? So like a little V and then a line. And then I'm going to do a tiny little droplet, and that is to enhance the GK point, right? You can do the little droplet like I like to do it because I feel that it's easier for the patient, or you could go in if you wanted to from the GK point going in this direction, right? And then retrograde, deposit a little bit of product to enhance that Cupid bow and that GK point. I feel the little droplet that I do normally works really well and is not as painful for the patient. So that's what we will do today. Okay. So we will do a little droplet right there. And then after that, I'm going to come down and we're going to start working on the bottom lip. Okay. I will do my little lines. Remember that golden ratio, right? So we don't want to give her lips that are not fit for her face. So I always do my little lines. Ala of the nose, inner canthus, right? That medial fifth of the face. And then I always mark the midline because that's normally, and I don't know if you can see it, but she has it. She has a tiny little bit of the keyhole pout going on. I don't know if you can see that little tiny space right there when she's relaxed. She has the nice little cleavage naturally, right? So she even has like a little wrinkle or a little line right there. We're not touching that. That's beautiful. It's staying there. We're just going to enhance the pillows on the sides, okay? So when I start working on the bottom lip, I always do a little line on the vermilion border, okay? Right here in the middle. And then I work on the pillows, okay? And I do a little V right there for the pillow and another little V for the pillow. This way, like that. And then after that, I will lay her back a little bit. And then we're going to start doing the Julie horn technique or the little threads, okay? And how I do it, it's just tiny little lines this way, okay? And it depends on how they look, how many I'm going to do. This is an art, right? There's no like a set number that we need to do. I normally do like maybe 3 or 4 on each side, depending. And if we have asymmetry, which is very common, I will do a little bit more, a couple of extra lines on the other side, and that's okay. I normally, and I'll show you, right? I'll normally place my finger like this so we can invert the lip, which is what we are trying to do anyway with the little lines. And then those little threads, it's hard to tell how much we push on it. It's such a tiny amount that I'm honestly not even looking at the syringe anymore. I'm more looking at the lip, at the actual tissue and how it's plumping. So I will say probably less than a 0.05 on each little thread. So that's what we will do. Okay. So let me wipe all the little bit and then we'll start. Mm-hmm. Nice and superficial. Okay. You see, I'm tilting my needle. I can see the shape of the needle, but not the color. Okay. So that's dermis. And I'm going to push like a 0.05. Again, I don't even look at the needle anymore. I'm going to do the B. Okay. So I'm a little bit lower than where I started. And I'm going to push a little bit more there too. You go. How was it? Not too bad. So, and I did a 0.1. I don't know if you can see it. I wasn't even watching, but it was a 0.05 on each one. So now we're going to do that second line. Okay. You see how her lip, it's kind of like going inward. So I'm going to put my finger here just to show a little bit more of the pink. Okay. And then I'll do the little injection. Just one single line. Remember that the lips are supposed to taper down on the corner. So you don't want to push a lot of product on the side. That doesn't look good. Okay. The volume of the lip, it's supposed to be majority of the volume. It's supposed to be in the medial section, that area where you have that inner face of the face. And that's what looks beautiful. And everybody's going to be different. That's why I like to mark those borders. And I like to stay in between those borders. Okay, you can see a little bit of the volume already. And I go to the other side. Yeah. That's it. Okay. Felt it a little bit more or less? A little bit more. Okay. Sometimes that happens. Sometimes the lidocaine just takes better on one side than the other. So that's not uncommon to hear. And when you're doing lips, something that I feel is really important, especially if you're starting, try to stay on the pink of the lip. Don't go too far back into that wet to dry border, because that's an area where the product just kind of like goes into and pulls in there. And then you find patients coming to you with, I have never done my lips, or the last time I did my lips was like 3 years ago, 4 years ago. And then you check, and when you lift the lip, you see all the product kind of like pulling in there. So try to stay on the pink. Don't go too close into the mucosa. And remember, every time you're injecting, you're assessing, right? All the time. You're assessing for the color, any crazy swelling that it's not supposed to be happening, anything. So now I'm going to do that little technique of the little droplets right on the GK point, just with the bevel of the needle. Little, and it's just on the GK point. Tiny little bolus right there. And you can see it, how it's like lumping the area. Probably like a 0.05 or even less than that. And then I kind of like mold it as a little triangle. And remember, the product is really soft, so it's going to mold exactly how you put it. You see how pretty? And it's so much easier than that injection where you come in and do that line. We are at this point a little bit before the 0.7. So I did a 0.3 total in there, okay? I'm going to do, or the goal is to do a 0.1, okay, on this little line. Yeah. So what I want to do, I'm going to do a 0.1, right? I want to have half of that needle on this side of the line and half of the needle on my side of the line. So kind of like measure it without touching the tissue, right? Just floating, and then go in. Poke, poke. Nicely bent. Beautiful. All the way in. And then we're going to do a 0.1. And that, because you're doing it kind of like on the vermilion border or close to the vermilion border, right? Remember, more on the pink than on the white, right? It's going to give you kind of like, it's going to give you a pout out, okay? This injection will pout it out, and this ones will evert the lip, kind of like those little threads, okay? And then we're going to go for the pillows, okay? And the pillows you want to do, you don't want to add anything in the cleavage, right? You want to stay away from that midline. So I'm going to stay a little bit more lateral. So in between the line, right, where her volume is supposed to be, and the cleavage. That's where I'm going to do that little pillow, or try to recreate a little pillow. And I did a 0.1, so I'm a little bit behind 6. And I mold it like I want it, right? Like a little pillow right there, kind of like pulling it this way. Okay, go to the other side. I'm doing a little V, right? So I go in this way, retrograde, and then turn, retrograde again. And I did a 0.1. So 0.05, 0.05. And we have done total, we are just, we're about 0.4. So 0.6 we have done in total. We are at the 0.4 line. So I'm going to lay you back. Okay. I'm going to change the needle so it's nice and sharp when it's easier for you. I'm going to lay her back a little bit, and then we're going to do those little threads. Okay. Or the uniform technique. And I'm thinking maybe a 0.2 or a 0.2 for the whole lines that I'm planning to do. I want to save a 0.2 for the oral finishers at the end. So we're gonna do a total of 0.8 on her lips. So I'm gonna press with my fingers, right, to kind of like flip the lip a little bit, okay? And then I'm gonna go in on the pink, not on the white, right, but on the pink. And I'm gonna leave tiny little lines of product right there. And I don't know if you can see it, but there's a tiny little droplet at the end of each injection. That's what you want to see. And try to stay nice and superficial with your injections. Don't go too deep with them. Right now, she's a little bit swollen because we already did the other injection, so it's hard to tell the depth of it, but it's pretty superficial. Remember, this is Kiss, right? So don't be afraid of the product being bumpy or anything like that. It's a very soft product. Beautiful. I did a 0.1. I don't know if you can see it. Go ahead and raise your head.
Whoa.
Mm-hmm. Sorry. It looks really good. And it depends, like, what are we trying to achieve, right? Where do I start these little lines? If the patient has those, you know how some patients will have the lips, the corners of the lips, super kind of like slanted, and you almost don't see any of this area right here, this lateral area. Well, concentrate on that area, right? So you can flip a little bit of that pink. She has beautiful lips to begin with, so we're just enhancing her natural lips. So I'm doing maybe like 5 little lines, okay? Starting from here and all the way to here. And I'm in the second, so this is the third. And again, this is an art, right? So it's hard to, I just go with what I'm seeing more than counting or like checking on amounts. But I guess that you develop with time. So in the beginning, yes, pay attention to how much you're doing on the GL drop. Oh, that looks so good. You're gonna like that. Okay, perfect. So now I'm gonna sit her down again. And then I'm gonna add a couple of little lines on the bottom, right, to enhance those little pillows too. And then at the end, we'll do a tiny little bit in the corners of the mouth. That looks really good. Go ahead and smile for me. Can you big smile? Okay, relax. Smile for me again. So now I'm going to do a couple of little lines on the top, right? Just on the bottom, just like we did the top like this, right? Little lines this way. Now we're going to do little lines this way on the bottom lip. Okay. We have a tiny little bit over 0.1 left. So I think we're going to end up needing a separate syringe for the corners. We can do the corners and we can do a little bit of the marionette so we don't waste anything. Do you want to do the L? Or did you open the kiss already? Okay.
It's still still.
Okay.
So if you don't need it, I can put it back.
I think we're done with the actual lips.
Okay.
So maybe we did L on the corners, it will work better because it's like a more cohesive product.
Okay.
Uh-huh.
Oh, so you want L?
Yeah.
Yeah,
Mhm,
okay.
mhm, yeah. If it's not a problem, yeah, I think that will be a better product. So look at the difference that those little lines is making. Okay. Go ahead. You see how much projection you see here compared to this, that it's kind of like, so you're kind of like bringing the lip out or giving the lip a little pout out. I don't know if you can see it in the camera,
Yeah,
but it's definitely noticeable in person.
And we can see it on camera. too.
Okay, good. So tiny little lines, nice and superficial. And you want to see that little droplet of product at the end coming in from the pink. Don't come out on the white roll because then the patient ends up with that product that you're leaving outside, kind of like almost migrating. Very good. That's so pretty. So this is Restylane L. Okay, we're going to use Restylane L for her oral commissures. And since we have the full syringe, right, we're not going to waste anything or much. Or let's do a little bit of our marionettes as well. So let me clean a little bit. So the lips, right? We use Resilient Kiss, which is the product that is approved for lips, right? So it's nice and soft. But in the beginning, for the first probably week, okay, to even 2 weeks, you may feel the product or you will feel the product feeling a little bit bumpy. Okay, that's super normal. You're gonna feel lumpy, bumpy. Okay, in the beginning, it's just a little bit of swelling. Okay, that the body naturally creates surrounding the product. So it's very normal to feel it bumpy. Don't mold it, don't press on it, don't massage it. Okay, I will give you a little massage right now, so everything is nice and smooth. So you don't have to. Okay, don't touch it. Okay, let it settle by itself. Like I said, they're gonna feel a little bit bumpy in the beginning. But after a couple of days, the swelling is going to be gone. If you happen to develop a little bruise, the area where you have the bruise, it might look a little bit bigger than the other. It's not going to look perfect for it may not look perfect for the first probably 10 days to 2 weeks. Okay. It's just swelling. So let it settle. And when I massage, if you feel any little lumps or bumps, don't be afraid of massaging it. Just mold it so everything feels nice and smooth. Because after they leave, right after the patient leaves, they're not going to want to massage it on their own because, first of all, they're tender, right? So they don't want to be causing pain on themselves. But they're afraid of damaging the product. So make sure that everything feels nice and smooth before you leave. And just explain to the patient, right, that it's kind of like normal to feel that way in the beginning. And then just instruct them not to touch them or press on them or do anything. For the first, the instructions that I give my patients is no lipstick or lip gloss for the first 4 to 6 hours, okay, as a minimum. Try not to eat anything for the first hour because right now you're so numb that you might bite yourself, okay? So be very careful with that. And then no touching, okay, for the first, no touching meaning no massaging, okay, for the first 10 days to 2 weeks until everything's good.
You look great.
They look so good. They look so good. So what I'm going to do right now, okay, with the different type of product.
Okay.
So we're going to do a tiny little bit on the oral commissure, okay, with age, right, or the aging process. The first thing, or one of the first things that we see whenever we start losing the cheeks is that the mouth starts kind of like drooping down as well. So we start seeing that oral commissure coming down, which you probably have treated before, Jennifer, because it doesn't look that deep. But the corner of the mouth starts kind of like drooping down, and then we start seeing this line that we call marionette. Okay. So, and then we start seeing the jawline, right? Like that little pooch. So what I'm going to do, I'm going to add a tiny little bit on the corner of the lip just to lift it up a little bit. And that's going to make your lips look even better than what they look right now. And then I'm going to do a tiny amount right here, okay, on what we call the pre-jaw area, which kind of like tends to give us like a little shadow. And then it makes everything look kind of like, okay. Remember that Restylane L is one of the first syringes, right, that came into the market with the Restylane family. So it has that old kind of like syringe. It's actually a 3-part thing, okay? This comes apart, okay? So, or it comes out. So whenever you're gonna open the syringe, I always train, right, to hold this bottom part, okay? I don't know if you can see it, that it's kind of like 2 little pieces. Hold the bottom piece before twisting the top, okay? I think you can see it. I think they can see it. So it has 2 little pieces. So hold the bottom right before clicking open the top. Because if not, it's going to come like up and then you're going to break the syringe. And then you lure lock the needle, right? And remember that Restylane L comes in the little tray with 29 gauge needles. You know, the FDA studies are so difficult to change right after they develop the product. So because of legalities, they cannot put the 27, which is normally what we use, inside the tray. So they will keep coming with the 29s. I really don't use the 29s. I use a 27 all the time whenever I'm using Restylane. So when they developed the product, they developed it with the 29. And then after starting using it, we noticed that it works better with the 27. So that's what we do. Really good. Okay. So the little trick that I do for the oral commissures, I'm going to do it with a pencil first. Okay. And she doesn't have a lot of issues, but whenever the patients have that deep oral commissure and then you do that little trick, it's just like magic when it lifts. It's awesome. So what I'm going to do, standing on the right side, right, I'm going to work on the left side of the patient. So I'm going to have her turn her neck just a little bit. And what I'm going to do 2 little lines or 2 little retrograde lines one right on the mucosa, okay, of the lip, on the white, okay, and then I'm gonna give her a little bit of support, doing like a little V this way, okay. But when you do that line that is very close to the mucosa, you really want to see a little bit of the product kind of like plumping this little area right here on the corner, because that's really what is going to give you that nice turn, okay? And then I'm going to go around the chair, right? Standing on the other side, I'm going to work on this side, and I will do the same. I will do a little line this way, and then a little line this way. And that gives us just support and lift, and then we'll work on the perioral area. In the perioral area, you can do with cannula if you want to, okay? You will do a tiny little poke right here, and then go with a cannula and just kind of like deposit a little bit of tiny little lines, right? Or you can do it with a needle. I'll do it with a needle today, okay? She doesn't need a lot, so I'm going to concentrate just right here. And when I'm going to deliver that first line, I always like to pull the skin, like I want the skin to go, or the angle or that direction where I want the skin to go. So I always pull this way, kind of like going up. And then nice and superficial, okay? In dermis, you can see the shape, but not the color. And deposit a tiny amount in there. Remember, it's a 27, so it goes nice and smooth. Okay. Perfect. So for her, because she doesn't have a big issue of the oral commissure burning, it's more like support, okay, than anything else. But I hope you can see the little difference that it's making. So one little line right there, and then one little line right there, like a tiny little V. You see it right there?
Mm-hmm.
Mm-hmm. And then a tiny long, probably like a 0.05. Okay. Like I said, I don't really much. And I did 0.2, so 0.1 on each side. Okay. Now we're going to concentrate on this little pre-jaw area. I'm going to draw her jawline. She has a beautiful chin. If not, I would add a tiny little bit of chin. But she is perfect. Like her profile is perfect. Have you done any chin on her? Mm-hmm. Okay, so you're blessed with that beautiful chin. And then I just draw, I have them do kind of like their orange peel kind of like motion, okay? So I can see exactly where that muscle is. And then I just draw it, okay? And then I always kind of like push with my fingers to see exactly where they have that natural kind of like jaw, right? And I mark that. And now I know that I need to concentrate in this little area, okay? This is the pre-jaw area. So I'm gonna add a tiny little bit of product. I'm gonna come in right here and do little lines like this. I'll probably do that like a 3. Remember that this is exactly where your inferior labial artery is. So you will see me aspirating every time, okay, with every line. Dermis, okay, shape, but not the color. Aspirate, tiny little line. Aspirate, tiny little line. Again, she doesn't have a lot of issues with her pre-jaw area. It's not super deep. But if they do, on top of doing that, you can do a little line right here, and that just kind of like blends everything very, very nicely. I think I'm gonna do that. When here, you can see kind of like this indentation and then this indentation. So we're kind of like blending that pre-jaw area and into the jaw. So you don't see it, you don't see the irregularities of that contour. And I did a 0.1 on each little line. That's great. Dermis, okay. That's great. If you want to, if the patient has a lot of volume loss on the perioral area and you really need to add a lot of product, I would recommend you to go with a cannula so you can go a little bit deeper. Right now, we're pretty safe because we're superficial in the depth of the needle. But this area, if you want to go a little bit deeper, definitely cannula is a better option. And Resident L, even if it's like a big molecule, if you think about it, right, molecularly, it's a big molecule, it's nice and soft. So you can definitely play with it in different areas. I think it's very versatile. So instructions for the patient, don't touch it, don't rub it, don't press on it, just let it settle, okay? The product will feel a little bit bumpy, lumpy in the beginning. You may develop a little bruise, okay? Maybe tonight or tomorrow morning when you wake up, you will see a tiny little bruise. That's very normal. Some bruising, some swelling, some tenderness, super normal every time we do filler. What is never normal if it's something hurts, okay? Pain is not normal, tenderness is, but pain is not. So if something hurts, you let her know right away, okay? If you have excessive swelling or excessive bruising, right? Or bruising where we didn't inject. Let's say we did your lips and your perioral area, but you're bruising on your nose, even your chin or under your submental area. That's not normal. Okay. So you have to let us know right away. Everything looks amazing. Okay. Try to avoid any ibuprofen for the next couple of days. Try to avoid heavy exercise for the first 24 hours so you don't create a bruise. And try to avoid any heavy alcohol. Okay. For the next 24 hours. The product that we use right here, Lacey, it's a little bit thicker than the product that we use on your lips. Okay. Because we wanted to give you a little bit of volume right there. So it might feel a little bit different under the skin. Okay. And that's very normal. Don't mold it, don't touch it, just let it be.